So the soft tissue surface anatomy for the lateral aspect of the elbow is kind of fun. We've got several different structures to be able to identify. What we're going to start with first, more proximally, is the brachioradialis. The brachioradialis you're going to find by being in a neutral position. You're going to, at the elbow at 90 degrees of flexion, and I'm going to give some resistance. What we're going to see is that brachioradialis coming out. It's going to come from the proximal 2/3, good, and relax, of the supracondylar ridge. So I'm going to just trace that out here. It's a large muscle. I like to call it the canoeing muscle because when you canoe and you paddle, that one kicks in. Usually by the end of summer, mine's quite large, my brachioradialis, but that's the only time of the year. So here, so this is brachioradialis. It does not cross the wrist. Okay, then we're going to find extensor carpi radialis longus. So that muscle, how we're going to identify that is we're going to pre-position his wrist in extension and radial deviation. I want you to hold that. Don't let me move you. And this looks kind of like an egg. It comes in. It's going to attach on the distal 1/3 of that supracondylar ridge. So I'm going to just hold that here while I draw that out. So hold, good. So this is the muscle belly of extensor carpi radialis longus. Here, and again, it's that attaches to that distal 1/3, and it kind of looks like an egg as you trace it out. Good. Go ahead and relax. So let me just mark that. ECRL. Then we're going to look at the brevis, and the brevis is going to be most important for us because that one is going to be most involved with a tendinous involvement of tennis elbow or lateral epicondylgia. So how we find that, so the kind of neat thing is as the ECRL becomes more tendinous, this is where we're going to find the muscular portion, the muscle belly of ECRB, and it's going to narrow and be a tendinous portion, a long portion, and it's going to be coming off of the top of that box, that 5mm by 5mm lateral epicondylar box. So let's come in and we'll do that one in purple. So I'm going to have you now just hold here. Don't let me move you. Hold there. Hold. So we can palpate that right as the ECRL is starting to get narrower. Now I can find that muscle belly of ECRB. Here, coming in. And it's going to narrow into a tendon. Go ahead and relax for me. And that's going to come up, and it comes right off of the very top of that lateral epicondyle. And we can see why when we look at the anatomy, our ECRB is our strongest wrist extensor. We can see how when it comes up, it's a very narrow tendon that comes off of the top of that lateral epicondyle. So you can see how it kind of sets itself up for tendinopathies. So then we're going to come in, and right underneath our ECRB is we're going to find the EDC, or extensor digitorum communis muscle. How we find that is we're going to have him flex his wrist, and I want you to play the piano, and we're going to see, you can see flickers right here of that muscle belly. So go ahead and keep playing. And here we have our EDC. Our EDC, it overlaps a little bit with ECRB. So here is EDC coming in, and it's going to come off of the anterior portion of the box. So EDC. Perfect, good. Okay, then we have extensor carpi ulnaris, or ECU. We're going to find that here by bringing, go ahead and bring your wrist back into extension and ulnar deviation, and hold that. Don't let me move you. Ready? Hold. Hold, hold, hold. Come on, hold. So here we have the muscle belly of ECU. It's going to come up, and it comes off of the inferior or caudal portion of the lateral epicondyle. So I'm going to follow that. I'm going to use orange here, so hold that for me. And I'm going to come in. ECU. Good. That one's a little harder to see. Good, and relax. And last but not least, we're going to find an important muscle that sometimes is involved with lateral elbow pain called the Anconeus. It's one we kind of forget about. But the Anconeus is this little triangle that's left. So it comes off of here, the ulna, And if you give resisted elbow extension, hold that for me, don't let me move you, you'll feel that Anconeus come in. So the Anconeus is that little triangular muscle. You can see that muscle belly right there. We'll put ANC for Anconeus. So that completes the lateral side of the soft tissue for the elbow. Now we're going to move on more to the anterior aspect. So let's identify first. I'm going to come in here. We're going to find our biceps brachii. So we're going to come in here. I'm going to just ask him to keep his form in a supinated position. Here's the biceps muscle belly coming in. I'm going to palpate all the way into this insertion on the radial tuberosity right here. Go ahead and relax for me. So let me trace that out first. Here. Okay. Hold there for me. Good. So I'm going to trace out here. Okay, and the biceps we know is more of our glamour muscle, but the brachialis, which we'll identify in a moment, is really the workhorse. And we can palpate that coming all the way into the radial tuberosity. The myotendinous junction, go ahead and relax. So we're going to feel at the radial tuberosity, we're going to feel that more pencil-like structure of the tendon, but as we move more proximally, we're going to feel it start to soften. And when it starts to soften, here, that is our MT junction. If we go a little more proximal, it's very soft, and that's muscle. So that in between is the myotendinous junction. So I'm just going to draw that out right here, the MT junction. So once you've identified the biceps, the myotendinous junction, and the biceps tendon, if we push the biceps more medially, we can palpate the brachialis. And that's our workhorse for elbow flexion. Because it attaches to the ulna, regardless of the forearm position, that brachialis is always firing. So now we're going to follow just medial to the biceps at the MT junction, and we're going to identify two cords. And these two cords are pretty important because they're the median nerve and they're the brachial artery. So when you feel these, you want to be gentle, but when you feel a pulse, you know you're on the brachial artery. I feel it right there. And if you put a little too much pressure, you want to be gentle with the median nerve, that cord-like structure. Sometimes patients or your partner will start to feel a little bit of numbness or tingling. So we want to make sure we're following that gently. But that is here. We have our brachial artery, and I'll put in blue, median nerve. Okay, now we're going to follow here on the medial side of the elbow. Okay, I'm just going to place this here. Okay, so we've identified the medial epicondyle and the medial supracondylar ridge. Now the flexor pronator is it's got a common tendon and muscle belly as it comes off of that medial epicondyle. So I'm going to have his fingers more in an extended position here, or just relax actually. And I want you to come in, I want you to hold your wrist here, don't let me move you. So if we follow here, here's our proximal attachment. We're going to feel a pencil-like structure. That's the tendon, and we're going to come down a little lower for the MT junction. So I'm going to sketch that out. Go ahead and relax for me here. Okay. And here is our flexor pronator. And so I feel here is very hard and tendinous. As I come down, it starts to soften. That is our MT junction right here. Good. Now, we find here, if we come between, at the level of the MT junction of the flexor pronator group, between that and our olecranon is where we're going to find our ulnar nerve. So the ulnar nerve is going to come down medial to the triceps, come in, here is our cubital tunnel, medial epicondyle and olecranon, following down, and our ulnar nerve comes through here. Again, you want to be careful with that. As that comes down, that you're not putting too much pressure. And then the ulnar nerve is going to go between the two heads of flexor carpi ulnaris as it enters the forearm. So now we've identified our medial-sided structures, our anterior elbow compartment, and the extensive lateral compartment.